So today we shall learn about ventilator graphics. So what is the use of this ventilator graphics? So we can detect auto peep and we can determine whether there is any patient ventilator dysynchronized or not, and patient is having bronchospasm or not, and also to assess the effectiveness of bronchodilator administration and to detect equipment malfunctions, and also determining appropriate PEEP level, because in order to prevent the collapse of the alveoli we need to know what is the appropriate PEEP level. For example, in a patient with ARDS we need to set a certain amount of PEEP such that because whenever the PEEP is kept at a lower level then airway collapse occurs. So in order to prevent that one, so this ventilator graphics will be very useful, and also to detect any leak in the circuit. So the ventilator graphics are we are having broadly as scalars and loops. In scalars we have got flow time, volume time and pressure time scalars, and in case of loops we have got pressure volume loops and flow volume loops. So first, before going into the details, we should know what are the basic waveforms which are seen in ventilator graphics. So first, coming to the flow time waveforms. In case of flow time waveform, I have told this in the previous slide, that is in case of modes of mechanical ventilation part 1. In that lecture you can find in detail. I have explained this flow time waveform. So broadly we are having this flow time waveform, that is rectangular. This rectangular flow time waveform, this is also called as constant flow. This constant flow type of waveform is seen during volume control ventilation. This sinusoidal type of waveform, flow time waveform, is seen during spontaneous ventilation. This ascending ramp is also called as accelerating flow. This is not used because it is not physiological. This descending ramp or decelerating flow, this is seen during pressure control ventilation, and this is exponential decay. Now coming to the pressure time waveform. In case of pressure time waveform, we have got, this is rectangular. This is rectangular, this is nothing but constant pressure. Pressure is not rising above this certain limit point. So this is seen during pressure control ventilation. And here this is the exponential rise in pressure is occurring. Here this is seen during volume control ventilation. And now we have got, in case of volume time waveform, we have got this ascending ramp. Ascending ramp is seen during mandatory breaths, and this is sinusoidal. Sinusoidal is seen during spontaneous breathing. Now coming to the individual scalars, we have got this flow time scalar. So we shall know what are all we can diagnose by using this flow time scalars. So here this is the flow time scalar which is seen during spontaneous ventilation. So here spontaneous ventilation, this is the sinusoidal waveform which you can see during spontaneous ventilation, and this is the expiratory time waveform. So this is the green is the inspiration and yellow is the expiration. In case of mechanical breath, so here you can see these are the mechanical breaths. In case of mechanical breaths, here you can see this is the constant flow waveform, that is also called as rectangular type of flow time waveform. This is seen during volume control ventilation, and here after this constant flow there is a pause. This is called as inspiratory pause or inspiratory hold, and here you can see this is the decelerating flow or descending ramp. This is seen during pressure control ventilation. So now coming to the inspiratory flow pattern. How this inspiratory flow pattern will be. So at the beginning of the inspiration, here you can see this is the beginning of the inspiration. At the beginning of the inspiration, the exhalation valve closes and there is flow of gas to the patient. So this is the inspiration. Up to this point is the inspiration. So here this point is called as the peak inspiratory flow rate. That means maximum, that is flow rate. So this is also called as peak inspiratory flow rate. Usually it is set around 40 to 45 liters or 40 to 50 liters per minute. So in order to provide adequate flow to the patient. And here, after this inspiration, here the beginning of expiration and exhalation valve opens here. At this point the exhalation valve opens and the expiration starts. So here you can see this is the expiration. So here now when you see this expiratory flow pattern, so here the exhalation valve opens and expiration occurs. So here this is the expiratory flow time waveform. So here this peak point is called as the peak expiratory flow rate. Okay, so this is the peak expiratory flow rate, and this point at the inspiration, this is the peak inspiratory flow rate. And this duration from the beginning of the opening of the exhalation valve to the next inspiration is called as the expiratory time. So now we shall learn about this inspiratory pause. So in this graph you can see this is the inspiration followed by, there is no flow of gas here. The flow of gas is there. This is the peak inspiratory flow rate, and followed by there is a no flow of gas. This is called as absence of flow or inspiratory pause. So this is called as the inspiratory pause. So how do you diagnose whether the inspiratory flow is adequate or not? By seeing this flow time waveform, we can get to know whether the inspiratory flow is adequate or not. Normally, the inspiratory flow, it should be like this. In case of volume control ventilation, it is square type waveform. When the inspiratory flow is inadequate, then an initial peaking occurs. So this indicates the patient's effort, that is active inspiration. So this is the, here in this graph you can see there is a decelerating type of or the descending ramp type of flow time waveform seen during pressure control ventilation. Before the inspiratory flow it touches the baseline, the exhalation is starting. So this indicates an insufficient inspiratory time in this patient. So here in this graph we can see this is the inspiratory time, inspiratory flow time waveform followed by inspiratory pause and exhalation. And before the exhalation it touches the baseline, next inspiration is starting. This indicates there is insufficient time for expiration. So expiratory flow, it does not touch the zero. So before it touches the zero, next inspiration is starting. So this is seen, this indicates insufficient expiratory time, and this is seen in patients who are having air trapping, autopy in case of inverse ratio ventilation and COPD. So in case of COPD, what happens here is before the expiration is complete, so the next inspiration will start because there is a lot of bronchospasm is there and patient needs a lot of expiratory time, and that before the expiration is completed, then the next inspiration starts. So and that results in air trapping and autopy in a patient with COPD. So now here you can see this is the flow time waveform. This is the constant flow and inspiratory pause. This is the expiratory flow. So here we can see the peak expiratory flow is decreased. So this dotted line is the normal peak expiratory flow, and this is solid line is the peak expiratory flow or expiratory time flow time waveform in this patient. So this dotted line, it indicates the normal, but here it is decreased. This decreased peak expiratory flow rate, it indicates bronchospasm. When this patient is, when we administer bronchodilators to this patient, then this peak expiratory flow rate, it increases. So whenever the airway obstruction is reversible, then there will be a response to bronchodilator. So next, now coming to this volume time waveform. In case of this volume time curve, we can see this is the volume time waveform here. This is the volume time waveform in case of this is the volume time waveform in case of volume control ventilation, and this is in case of pressure control ventilation. So here the volume time waveform, here you can see the beginning, that is the first half of the curve, it indicates the inspiration, and the remaining half it indicates the expiration. So this indicates the inspiratory tidal volume, and this indicates, and the remaining part indicates the expiratory tidal volume. So what is the use of this volume time waveform? Volume time waveform, it can be, by this we can know whether if there is any air leak is there. As you can see here, the expiration, it is not touching the baseline, so it indicates there is some amount of air leak is present. So from this point to this point, this is the inspiratory tidal volume, and before the expiration it touches the baseline, so it is not touching the baseline. This indicates leak is present in the patient. So this amount of indicates the amount of the volume lost. So now coming to the pressure time scalars. In case of pressure time scalar, this is also very important. We can diagnose many conditions during using pressure time waveform. In case of spontaneous breath, the pressure time waveform will be like this. Because spontaneous breath, the inspiration will be a negative pressure. So we can see this inspiration, it goes below the baseline. So followed by expiration on the positive. So in case of, this is the pressure time waveform in case of time triggered breath and volume control ventilation. So here this is the time. So this is the time triggered. If it is an assisted breath, then it will be like this. So initial triggering will be by the patient, followed by the mandatory breath. So this is called as continuous mandatory ventilation assist control mode. So that is assist control mandatory ventilation. So only the triggering will be by the patient, and rest of all the parameters will be controlled by the ventilator. That is the inspiratory time, the tidal volume, positive and expiratory pressure, everything will be controlled by the ventilator. So what are the components of the pressure time graph? When we see here this pressure time graph, we can see here from point A it goes to this point C. Then here there is an inspiratory pause. So here the pressure, when this inspiratory pause, the pressure drops from D to E. So then expiration starts. Here the exhalation valve opens and it goes from E to F. So here we can see that the point C, it is the maximum, it is the highest point it is the highest point of the pressure time graph. So this is called as the peak pressure, and this E point is called as the plateau pressure. So what is peak pressure? Peak pressure, it is the maximum pressure during the inspiratory phase time, and plateau pressure, it is the pressure which is measured during this inspiratory pause. So resting airway pressure during the inspiratory pause is called as a plateau pressure. So whenever this inspiratory pause is applied, what happens? Then there occurs displacement of volume and pressure compensation between different compartments of the lung occurs, and there is a drop in pressure. So here, as we can see here, the difference between C and E, this is called as a resistance pressure, and the difference between F and E, this is called as a compliance pressure. So this F and E, this indicates the compliance of the lungs, and the pressure difference between C and D indicates the resistance which is provided by the airway. So what is compliance? So before we should know what is compliance. Compliance, it is defined as the change in volume per unit change in pressure. So we have got two compliance, that is one is dynamic compliance and another is the static compliance. Dynamic compliance, it takes into the peak airway pressure, and static compliance, it takes into account the plateau pressure. So dynamic compliance is equal to tidal volume divided by peak pressure minus PEEP, and this static compliance is equal to tidal volume divided by plateau pressure minus PEEP. So this is the difference between dynamic compliance and the static compliance. So normal total static compliance is 35 to 100 ml per centimeter of water in an intubated patient. In a patient who is breathing spontaneously, the compliance of the lungs is 200 ml per centimeter of water. So in this graph we can see this is the peak airway pressure and this is the plateau pressure. This dotted line should have been the peak airway pressure and the plateau pressure in this given patient. But here what has happened? What has happened here is there is a rise in this peak airway pressure and also there is rise in plateau pressure. So here both peak airway pressure and plateau pressure are increased. So this indicates the compliance of the lungs is decreased. So the plateau pressure minus this pressure, that is this part of the the difference between the plateau pressure and the PEEP, it is increased. So this indicates the static compliance of the lungs is decreased. So increased peak airway pressure and plateau pressure, it indicates decreased compliance. You can see in patients who are having pulmonary edema, ARDS, fibrosis, and also interstitial lung disease. In this graph we can see here there is an increase in peak airway pressure and this is the plateau pressure. So this dotted line should have been the normal peak airway pressure in this patient, but it is increased to this point. So here, and this is the plateau pressure. So here what we can see is the plateau pressure is normal, but only the peak airway pressure is increased. So the difference between the peak airway pressure and the plateau pressure is increased. So the difference between the peak airway pressure and plateau pressure is called as the trans airway pressure. Whenever this trans airway pressure is increased, it indicates there is a bronchospasm. So this increased peak airway pressure and normal plateau pressure, that means it indicates increased airway resistance, COPD, bronchial asthma, tube kinking or blockade. All these conditions, they lead to this kind of waveform. So now coming to this airway resistance. How this airway resistance is calculated? Total airway resistance is equal to peak airway pressure minus plateau pressure. So the normal difference, it should be around 2 to 5 centimeters of water. So what are the other conditions we can diagnose with this pressure time waveform? Means inadequate inspiratory flow. So here this is the pressure time waveform in a patient with volume control ventilation. Here we can see there is an exponential rise in pressure. So this slope, it is convex shaped. So whenever there is an inadequate inspiratory flow, when you keep the flow rate, that is the flow rate what I have told previously as 40 to 50 liters per minute. If you keep around 30 liters per minute or 25 to 30 liters per minute, then this initial concave, the initial part of the curve will become concave. So this is called as scooping of the curve, that is pressure time waveform. So this indicates an inadequate inspiratory flow and patient will fight on ventilator. So here you can see, so this green color, it is the normal. So normal pressure time waveform. This dotted line, it indicates the inadequate inspiratory flow. So this is called as scooping of the pressure time waveform, which is seen whenever there is an inadequate inspiratory flow. So here pressure time waveform, here in case of spontaneous breath, These are all the waveforms you can see. In case of spontaneous breath, this flow time waveform will be like this, sinusoidal, and your pressure time waveform will initially there will be negative pressure during inspiration and positive pressure during expiration, and volume time will be same. In case of pressure support ventilation, here you can see, here in case of pressure support ventilation there is a decelerating flow. So decelerating flow type of waveform in case of pressure support ventilation. As you can see here, these are all patient triggered breaths. So initial part of this pressure time waveform is negative. This indicates that patient is triggering. So, and here one more thing, here you should not confuse that here this flow time, before this flow time waveform, it is touching the zero, the expiration is starting. You should not consider that it is an inadequate inspiratory time. Here it is not like that in case of pressure support ventilation. As I have told previously in the lecture on modes of mechanical ventilation part 1, in case of pressure support ventilation, when does the cycling occurs? The cycling occurs whenever this flow rate it decreases to 25% of the peak flow. So this is the peak flow. So peak flow, whenever this flow it decreases to 25%, then the expiration starts. So this should not be confused with the inadequate inspiratory time. So in controlled mode, in case this is control mode, that is volume control ventilation. In case of volume control ventilation, here we have got this constant flow. So this constant flow, and there is an exponential rise in pressure. Here this is SIMV, volume control ventilation. So here you can see this is the mandatory breath. So there is a constant flow, and here this is followed by spontaneous breathing. So it is a sinusoidal flow time waveform is there. In case of pressure, you can see there is a negative pressure is there. Initial this negative is there, and this is spontaneous ventilation. In case of pressure control ventilation, here you can see, in case of pressure control ventilation, the flow time waveform will be a decelerating flow or descending ramp, and pressure will be constant pressure. So in case of assisted mode, as I have told previously, only the triggering will be by the patient, and rest all parameters will be controlled by the ventilator.